Let us now talk about epigastric pain. The topic is retention of food. The clinical manifestations of retention of food are dull epigastric pain, which is worse with pressure, feeling of distension and fullness, belching, sour regurgitation, foul breath, vomiting of undigested food, epigastric pain relieved after vomiting, loose stools, or constipation. The tongue will have a thick, sticky coating in the center and root, which could be white or yellow, and the pulse will be slippery. This condition is very simply due to accumulation of undigested food in the stomach. This can result either from overeating or from deficient stomach chi being unable to make food descend. The accumulation of undigested food in the stomach causes the dull pain and characteristic feeling of distension and fullness. Undigested food obstructs the stomach and prevents stomach chi from descending. This causes belching, sour regurgitation, nausea, and vomiting. The fact that vomiting relieves the pain indicates that the obstruction in the stomach is of a substantial nature, that is, accumulated undigested food. When the obstruction is of a non substantial nature, such as stagnation of qi, then the pain is not relieved by vomiting. Whether there is constipation or loose stools depends on the relative strength of spleen and stomach. If the spleen is deficient, the accumulated food in the stomach prevents the spleen from transforming food essences properly, and this results in loose stools. If spleen chi is relatively strong, then constipation may result from stomach chi not descending and not moving the digestate downwards towards the intestines. The thick and sticky tongue coating in the center and root reflects the accumulation of undigested food in the stomach and intestines. It will be white if there is cold and yellow if there is heat. The slippery pulse reflects the accumulation of undigested food in the stomach. This pattern as a cause of epigastric pain is more common in children. The treatment principle is to dissolve accumulation, eliminate stagnation, and restore the descending of stomach chi. The acupuncture points to be used are Ren 13, Ren 10, stomach 21, stomach 20, stomach 44, stomach 45, spleen 4, pericardium 6, stomach 25, and using the reducing or even method. The explanation for the acupuncture points used is Ren 13 subdues rebellious qi and relieves belching, sour regurgitation, nausea, and vomiting. Ren 10 stimulates the descending of stomach qi. Stomach 21 is suitable for excess patterns of the stomach and it stops pain. Stomach 21 dissolves food accumulation and relieves fullness. Its name, Chengman, means bearing fullness. Stomach 44 and stomach 45 are distal points suitable for excess patterns of the stomach. They both stop epigastric pain, and stomach 44 clears heat and stomach 45 dissolves accumulation of food. In particular, stomach 45 relieves insomnia caused by retention of food. Spleen 4 and pericardium 6 in combination open the penetrating vessel. This is especially indicated in excess patterns of the stomach with obstructions in the epigastrium, a rebellious stomach chi, and resulting feeling of distension and fullness. And stomach 25 is the front collecting point of the large intestine. It resolves retention of food by promoting the bowel movements. For dietary advice, the patient should simply eat less and more slowly. Thank you so much for your attention.